All right, so here we are with the Fusion X heated massage gun. And I'm gonna use the flat round tip, and I'm gonna get the bottoms of her feet because everybody can use a really good foot massage, especially if you're dealing with plantar fasciitis. So on the bottom of the foot is super, super sensitive. So I make contact with the heel first very gently so she knows that I'm coming with the massage gun. So I'm gonna place this on her heel gently so I can see how she responds to it. She might not tell me how she actually feels, so body language is really important. I'm going to make sure that I'm feeling, I'm gonna watch her hands, I'm gonna watch her calves, I'm gonna see if she twitches at all. And most people, if they're gonna be really sensitive to the massage gun on the bottom of the foot, it's gonna be into the arch and beyond the arch. So I don't go into the ball of the foot when I'm using the massage gun. I stay in the arch, working across the arch, kind of in a zigzag pattern, again, very slow. And then as I get closer to the heel, again, side to side, across, until I get into the heel. When I get to the heel, I tend to stay away from this area right here because it's a vulnerable point for bone spurs. So I'm gonna stay on the border and towards the middle, but I'm not gonna go to the back side of the heel because we can access that tissue all the way up here into her knee. So from here, the other thing I'm gonna do is I'm gonna bend her leg and bring her foot down using specific pressure with the great toe. So my palm pushing the great toe down changes which structures are now available to receive this treatment. So we're spreading out the foot, putting it on a stretch, and just very slow working my way through. Now, something to make note of, there are a lot of nerves that come through, one of them being right through here on the base of the heel on the inside, and then you've got some tendons and some pressure points here along the outside. So I take a lot of caution in how I use the massage head based on how her body language is talking with me. So do you have to have the toe pulled down? No, you don't. But if you've got somebody that you're dealing with plantar fasciitis, is a great option. So from here, I'm gonna work my way up the side of the Achilles tendon on both sides, work my way up. Remember, we're trying not to make contact with the bony prominences or near any of the ligaments. We don't wanna stretch or mobilize ligaments. That's what connects bone to bone. We just want to mobilize the fascial connective tissue and the muscles that are tight. And so I'm working my way along the perineal on the lateral side of the lower leg. And she's ticklish here, as you can hear. And she's doing really, really well with this. So I'm gonna increase her intensity because as you can hear that she is laughing, there's a fine line between tickle and hurt. So we're gonna increase the intensity until she doesn't laugh. And so I'm gonna grab her from the base of her calf because right in here is a pressure point and right over on the outside is a pressure point. So on the outside, we have a nerve that sits real superficial to the skin about right here. And so down into here gets to be very, very sensitive area. So I start right here in the middle, work my way up very softly on both sides, but here on the inside of that gastroc muscle is a pressure point. So when she feels that, it's an automatic reflex for her to kick her foot up. So use caution because if I should hit that, it's going to kick her leg up and she doesn't have a lot of control over that. So I like to grab so that I can feel how much vibration she is receiving. How does that feel? Tickles? Not as bad. So you have to increase the intensity to get out of that tickle zone. And then from here, working up through behind the knee joint, but not going through the knee joint. Very important because there are a lot of tendons that cross over behind the knee and a lot of venous supply that cross through the knee. So it's a pressure point area. So something else that we can have her do is I can have her pump her foot up and down like she's pushing on a gas pedal, and I can work the tissue while she's activating it, which provides a totally different outcome. So if she's wanting to relax, this is not the exercise to have her do, but if she is in pain and we're trying to mobilize inflammation, then this is a really good exercise to do because we're activating the lymphatic system like a pump, and we're moving this fluid and lymph out of here. so that the tissues can heal. And so now we can relax.